Hello, everyone, and thank you for joining us today. My name is Tamar Westfall, Communications Manager with the National Center on Domestic Violence, Trauma, and Mental Health. Today's webinar, Healing Organizational Trauma and Supporting Resilience, will be presented by Cathy Cave, a Senior Training Consultant with the National Center on Domestic Violence, Trauma, and Mental Health. Before we get started, I would like to go over some technical details of the WebEx software that we'll be using for today's webinar. Many of these details are explained on the Using this Webinar System tab in the center of your screen. You can switch to this screen from the slides by clicking the down arrow next to Using this Webinar. Please be aware that your screen might look a little different depending on whether you're using a Mac or a PC. On the right-hand side of the screen, there are multiple boxes. The second from the bottom is the chat feature. You may have to click on the chat cloud icon at the bottom center of your screen to open the chat box. This feature will allow you to provide feedback and share resources with your fellow colleagues, as well as get in touch with the presenter if you have questions regarding the training content. You may contact Carla Alegria, also with the center, if you have questions troubleshooting the WebEx software. To do this, click the down-facing arrow and select the person you would like to contact. You'll see a lot of options, but for this session, you'll want to select all participants if you would like to respond to a question from the presenter or to contact center staff at any time during the session. You should click on Carla to privately contact us if you are in need of troubleshooting the WebEx software. So let's test the chat feature. Will everyone please go into the chat box, click on All Participants, and type in where you're calling from, then press Enter. Perfect. Thank you all very much. While folks can get a lot out of the chat feature, there are times when it moves really quickly and can feel distracting. If this is true for you, feel free to minimize the chat box by clicking the arrow next to where it says Chat. You can always open it again with the same arrow if you choose. We will be providing live captioning during this webinar. Below the chat box, there is a multimedia viewer box. This will contain the captions. If you do not want to see the captions, click on the same down-facing arrow next to the words Multimedia Viewer, the same way you might if you want to hide the chat box. Time permitting, I will moderate a question and answer session toward the end via the chat box. At the very end of the webinar, you'll be taken to a brief survey. Please take a moment to let us know what was useful and what could have been better. If you get disconnected at any point, return to the email you received with the original webinar link and re-enter the training. Sometimes the sound cuts out due to internet connection, so feel free to call back in if that's a problem for you. If you are experiencing technical difficulties and are unable to contact me, you may call WebEx Tech Support to resolve any issues. That phone number, which I will post in the chat box, is 1-866-229-3239. Again, thank you for joining us today, and I will now turn it over to Cathy.
Hello, everyone, and welcome to our webinar today. Just so excited to see where folks were located as I was looking in the chat and noticing just what a variety of locations and I'm assuming also interests that folks have. So I'm hoping that you will feel that our time is worthwhile for you today. And again, thank you for joining. So the National Center is a special issue resource center, federally funded, and our goal here in the work that we do is to offer training and technical assistance. We also have a body of research and evaluation materials and tools that we've created. We work on policy development and analysis, and, as Tamar has shared and you all have met, she's our communications person, and we're so excited and really thinking about our focus and expanding our public awareness and educating folks along those lines. So welcome, everyone. If you've been on webinars with us before, then this graphic is familiar to you. So we have what we call an integrated approach, and the framework includes really thinking beyond trauma-informed. What is it that our work really entails when we're thinking about advocacy in domestic violence and sexual assault programs and coalitions, And so our focus includes holding what we know about trauma and being trauma-informed, but also holding at the same time human rights and social justice, really thinking about the cultural context of people's lives and the community interactions and historical experiences that we've had. And we also think quite a bit around, at this intersection of domestic violence, we're thinking about what's the interplay with mental health challenges, and what's the interplay with substance use, and how are we supporting all of survivors and all of the experiences that they have, and can we hold that? So thinking about being survivor-defined, that we're doing nothing, that folks are not saying, yes, I want this and I'd like your support to do this. We think about physical and emotional safety, really centering on relationship and hope and resilience as a way of looking at our work, a way of looking at our products, a way of looking at our interactions, and holding, again, all of these pieces. So again, welcome. And what I would ask folks to do right now, just as we're getting started, is to get as comfortable as you can in the seat that you're in and just take a deep breath in. And then look around your space, and if you are lucky enough to have a window near your space where you can look out, go ahead and do that, or look at the colors in your room, around your computer, something that you can see. And if you could just put a note in the chat box on something that you're seeing right now that feels good to you. And so we'll wait a minute for folks to go ahead and add to the chat something that you can see that feels really, really good to you. Well, thanks, everyone. So we've got some things that are connected to nature outside. We've got pets and colors that we're connected to inside. So really, again, thank you, everybody, for adding to that and adding to the chat. And I would invite you, during our conversation over the next 90 minutes, to please use the chat function, share ideas and thoughts that are coming up, share questions. Tomorrow we'll be monitoring the chat for questions, so we'll try to get to some specific things and make sure we leave time at the end for that. So the focus of our conversation is around organizational culture, organizational climate, and what happens, what are the kinds of things that take place that lead to our organizations becoming traumatized, and then some strategies for what we can do about that. So that's the plan for our time together. And again, I invite folks to openly chat and let us know thoughts and things that are coming up for you as we proceed today. I want to start by defining organizational culture. So organizational culture is the what we do and the how we do it here. So we all work in different organizations, and what is it that this looks like? So thinking about this work from Shana Horman and Pat Vivian, it's really taking a look at what's the personality and spirit of the organization, right? Or what's the thing that we do, what's on our website that promotes what we do, how do we talk about what we do, and then there's the core identity that gets described when we're thinking about organizational culture, and that's the who we are and what specifically we do and how we do it. So as we're thinking about our organizations, I'd like to just, ask folks to reflect for a moment around, what is it that stands out about who you are, meaning your organization, and what you do and how you do it, and what stands out to you. And all of our organizations have a creation story about how we came to be. One of the things that can happen when someone is new to the organization is that during our interview processes, we, do a lot of describing about who we are, and we talk about that, and we encourage people to look at our information as we're interviewing and we're thinking about hiring and those kinds of things. And then because so much is happening in that process, some of that conversation may fade a little bit in memory. So then when we're hired in a new place and we actually start the work, it's really helpful to go back and to look at and think about, what were those things that described how our organization came to be? Are there more conversations I want to have about that? Because that can help me to understand, what it is that our big picture looks like. So there's my new job, there's my task, there's the things that are in my wheelhouse or under my umbrella. And then there's, what else do we do and how are we doing it? So as we're learning new roles and, participating in our organizations in different ways, it really is helpful, especially when in times of struggle, to come back to that creation story and to really think about what our moral narrative is. Like, why are we important to this work? And so as we're creating organizations, as we get excited about projects, or we're applying for a new funding opportunity, in those moments we may really be thinking about our organizational culture, and that includes the ways that people work together. But then again, those kinds of conversations and holding those perspectives can fade because we're busy then doing the tasks of our work. So it's really helpful to come back on occasion and revisit, what is our culture? How do we do it here? Organizational climate refers to how it feels to work here. So there's the what we do and how we do it, and then there's what does it feel like. And so what it feels like can rest in how are we communicating with one another? How are we working together, or what am I doing individually? How do I show up, and am I connected to the people that are also part of my organization? And do we have conversation that feels connecting? And so when it feels good, it's a positive organizational climate. When there gets to be lots of stressors, and, many of us have had lots of stressors in the last few months, part of what can get lost is we don't talk with each other about how it feels. So sometimes the way we're communicating through email or text can have an edge to it, and maybe that edge is unintentional, but because we're not connecting in other ways, especially in this virtual environment, we may be missing opportunities to, hold each other up, support each other, and really kind of hold on to how important the organizational climate really is. So when we're feeling disconnected, that distance gets filled with all different kinds of feelings. And so sometimes decision-making can change. The way we do it changes. And the way we're doing a lot of things has changed since the beginning of our response to COVID-19. So really thinking about then, what are the things that we might need to do so that we can stay connected, and that how it feels to be here continues to feel positive, continues to feel energetic, continues to feel as if we're all in this together and we're really connecting around the pieces of our work. So as organizations are operating, we're doing our day-to-day thing. When we're in person, there's different ways that we connect. We have staff groupings. I might have, there's a staff of 10. There may be 3 people that I'm, in communication with, 4, 5, 6, 7, 8 times a week. There may be other folks that, because of the way we're working, I may be only in touch with them once a month or less. And so it's really thinking and looking at how does it feel right now for us when we group together as staff, when we're communicating, when we're interacting with one another. And then how are we extending this idea, especially in this virtual environment, that we do support each other, we're here to support each other, and we want things to be inclusive. So what happens in this more virtual space is that we may be more in communication with people that we regularly work with. So the folks that are, our people in we talk to each other 6 or 7 or 8 times a week, we might make decisions together that might include someone else, but we're not thinking of that person. And so it's very easy for things to feel less supportive and for people to feel less included. And so it's really important for us to hold, we're not just here, we're also supporting each other and thinking about how it feels to be here. And how do we hold how it feels to be here? One of the ways we do that is with our supervisory structure and our supervisory practices and how leadership is in connection with everyone in the organization. So it requires some intentional outreach and connection, again, because we're in this more virtual environment. Some folks have worked virtually for a really long time, and this doesn't feel new. And for others of us, it's brand new. And one of the things that can, again, easily fade is how we celebrate or acknowledge the work where we've been successful. So all of these pieces definitely are included in the how it feels to work here and how much we're paying attention to how it feels to work here. So some cues around how is our organizational climate? There are some lenses that we can look through to say, hey, it feels pretty good most of the time for everyone, or no, it's not feeling that way. So paying attention to the emotional tone. If there's a lot of busyness and chaos, which is often part of our advocacy just because of the nature of the work that we do, does it feel like we're connected in that work? Or is there a tone or a feeling that I'm not quite fitting or I'm not quite connecting? And is it one person that's feeling that way, or is a lot of people that are feeling that way? And how are we paying attention to that? One of our big, challenges in our work, particularly in our advocacy, is because we're so attuned to what it looks like and what it feels like when there's an abuse of power. We're also finely tuned to knowing when power is being shared. And we might not name it, and we might not talk about that in a direct way, but most folks who are involved in domestic violence advocacy and sexual assault advocacy, we're thinking about power and the distribution of power and the sharing of power all the time. And so these are times, especially, again, given there's so much that's happening in the world right now, that it's important for us to pay attention to, in our interactions with one another, do I feel like power is being shared with me, or do I feel like I'm outside of things? And to ask those questions and really think about those things and talk about that as staff. And in staff meetings, what does this feel like for us and how are we doing? And so when the conversations are explicit, it can elevate that feeling of togetherness, even if in our conversation we identify that something might need to shift, or that we're feeling more distant from shared decision-making, or that we're not feeling a part of things in quite the same way. And there's also a place where we need to recognize that leaders in our organizations do have formal authority to act. And I think that's challenging in many of our organizations, because what we want to do is share power and share leadership. And at the same time, we don't work in collectives. Many of us don't. Most of us are not. most of our organizations are hierarchical in some way, and I think we work really hard in this field at trying to level that. At the end of the day, those in leadership roles have formal authority to act and to plan and to hold so much of what we do in the organization. So, of course, that's better shared and, having open and transparent conversations about where we are and how we are and what we're doing. But we also, need to just acknowledge that leaders have a formal authority and responsibility for making sure the lights stay on and the doors stay open and that we can provide the services we intend to provide. So it's not a collective, but we can be collaborative, and we can talk about and think about what's working in our collaboration with each other and what isn't, and be able to talk about those things. There's also a piece here around accountability. And, I've worked with a lot of domestic violence programs and coalitions and sexual assault programs and coalitions across the country over the last, decades. And I think this comes up for us a lot, where we really struggle with what does it mean to be held accountable. And so because we're, again, finally attuned to use and misuse of power, we can also be hesitant to talk about accountability. And accountability matters. And so if I'm a supervisor and I have a leadership role in my organization, or I'm a director and I have a leadership role in my organization, it is part of my role to make sure that people have feedback about their work, people have feedback about their behavior, and feedback is positive and negative. And so I think we shy away from it in this field a lot because we're hesitant to actually name when we're involved in judgmental behavior. And we are judging each other all the time. And so I want to just name that clearly, that in our leadership roles, it's really important that we think about our own accountability, our accountability to staff, our accountability to our organization, our accountability to the people we serve, and that staff are also, accountable. So we need to have conversations about accountability and responsibility that feel kind, that feel transparent, that feel really clear about, what it is that we're talking about in those moments. And so that means being specific. If we see a strength, naming that strength. But it also means if we see something that needs to shift, we need to talk about that. And as colleagues, we can hold each other accountable. So if I see someone who's in a role that's, a peer to the role I have, I notice something, I want to, with kindness and love and care, name what I'm seeing and talk about it and check in with each other and make sure that we're both doing all right or that we're all doing all right. It's when we shy away from these conversations that resentments build up, and that those resentments can really impact our ability to collaborate in effective ways. And so it's really thinking about, again, how do we keep moving forward and stay transparent and really stay connected at the same time we're acknowledging how things are and where things might need to change. So positive and effective climates look like something. There are ways that we show up and there are things that we do. And one of the key pieces that I love, and it's one of the first things you notice when you walk into an organization or you are interacting with an organization, that people view their work as part of a larger whole. And how you hear it is people will say, we do this and we do that, and oh, that's an interest for you. Let me share the work of my colleague over here. It's the ways that we talk about not just what our role is, but we are aware of what others are doing, and we are uplifting their work as we talk about our work. And that the communication is super inclusive and it's frequent, especially when times are changing. So a great example of that is our response to COVID-19, something that impacted the entire country that's has this global impact that's beyond our country. And we've all had both our individual responses to that, there's our family and community responses to that, and we've had some organizational response to that out of necessity. And so as we're making those changes, some organizations had a very high level of communication, and we talked a lot about, what is it that we're doing, how are we changing, and then even if we changed something and then figured out, this needs to change again, we had communication about that. And then we make sure that everybody on all shifts is hearing that communication, for those of us who don't work the 9 to 5, for those of us who are distant from our office, and maybe some folks were together and some of us were working from other locations even before COVID-19, making sure communication with those folks is frequent as well. And so it's making sure that everything that we do supports us feeling included and connected as a group as we deal with whatever changes are coming and as we continue to make changes as we go along. And so part of this, too, is making sure that as issues and challenges come up, we really discuss them with an idea for how can we resolve this. And so staff and leaders alike are feeling, we trust each other that we're going to work together to resolve this. So it doesn't mean that I have to be a part of every decision ever made in whatever organization I'm working with. It does mean that there's a way that I feel connected and updated, and I believe that when problems are raised, that there's a way that we're thinking together about problem solving. And even if I'm not directly involved, I trust that my group is working in trustworthy ways to resolve a challenge. And as we're thinking about approaches to, problem solving and staying connected, we're also holding that there's a willingness for individual and shared accountability. And so it's not just when something comes up, do we trust it? It's that is our way that we connect all the time, naming and shining a light on our trustworthiness of how we operate as a group, and do we trust that leadership is being shared? And so what can often happen as we are, navigating challenges and changes is that there's doubt, and doubt makes sense. There's a lot that's happening where we can feel, this might be new and this might be unexpected, but I believe that my group is in this together and we're going to manage it, whatever that it might be. There are things that absolutely can negatively impact the emotional climate in an organization. And so I want to spend a little time for us to think about that and to share some strategies and some ideas as we move forward. So I'm just kind of naming a few things. The one that comes most easily to mind is that we are involved in work where trauma is pervasive and persistent. So that means in our organizations, we have to right away be thinking about how are we doing, how does it feel to be here, because trauma is here every day. And it doesn't mean that we're not handling things well if we notice that there are challenges. It's the noticing can lead us to making changes. I think where our challenges arise is when we act as if trauma isn't happening, or that we're not impacted by it, or we don't recognize that it is pervasive, and we don't recognize that it's persistent. And so when we have that overlay of trauma's here, we're not really talking about it, we're not really thinking about it, but as part of our work every day, that disruptions in relationship are to be expected. If I'm in my job and I'm thinking I'm the only one who cares about this, or I'm the only one who's doing this, then I'm not giving my colleagues credit for helping to sustain our organization. And so it really does take all of us to make the organizational climate feel positive and to feel energized. And so when we're not feeling that and we're not talking about that, then things can get very siloed and people can get very isolated with those feelings that they're having. So we need a whole team to be engaged. When teams are limited in decision-making, they're not really part of policy creation. We're not naming the challenges as they come up, or we're not talking about ways to resolve those challenges. And the focus is just in, like, what are the tasks on my plate today? Then we actually can create challenges that go deeper and are harder to resolve the longer time goes on. I think many of us can recognize that when there's a tragic incident, so something comes up that is really painful with a service participant. It could be, loss of life. It could be that there's something that's happened where our relationship is disrupted because the person doesn't see us as trustworthy anymore. It could be something that happens with staff or a staff person's family, or ways that our whole program is impacted, let's say by, there's a funding change, or that the way we work needs to significantly change because of changes in policy. And those changes in policies could be at the program level, or they could be at the, at our funder level, or they could be, at more of a national conversation. So things that impact the way that we work and the way we feel about our work can negatively impact our organizational climate. So again, if we're not talking about it and naming those things, then we're missing opportunities to build that connection that we need that keeps us, focused and connected and working together. One of the other set of issues that can come up are leadership challenges. So this could be a change in leadership or a change in direction for leadership. It can be a leader is struggling with a particular, issue or topic, or that something's coming up in our work that, just the way that we're interacting doesn't feel trustworthy, doesn't feel as if we're all in the same container together. Like it feels like something's not quite right. Like those things can negatively impact how we feel about our work. And then we can also expect those same kind of feelings when some of us are being impacted by microaggressions that go unaddressed, or that there are other inequities that are coming up for folks that either aren't named, or maybe there's a few folks talking about it, but it hasn't reached the level of conversation for our organization as a whole. And I think across the country we were seeing a lot of those kinds of changes and challenges, in the spring, as there was more focus on racial inequities and on disparities and on, intersecting oppressions that many of us were feeling. And so when this stuff comes up within our organizations, it's really important, again, to address it, because whether we name it or not, these things are going to have an impact. And so as we think about organizations and trauma, it's just recognizing that our organizations can be traumatized in the same ways that individuals can be, and that this experience is collective, and it's also deeply personal, which is, for some can feel like a contradiction, but it isn't. There are things that bring us to the work where we feel really good about the alignment of our personal values and the work that we're doing. And when our organizations are traumatized, then there can be this disconnection where we all feel this sense of overwhelm, or many of us do, or one of us does, but where it's not named and understood as organizational trauma. And so there are many, many things that we do in our organizations and our programs and the ways that we work that are actually protective factors. And so when our organizational protective factors are overwhelmed, This can cause disruptions in the ways that we function, the ways that we talk about and feel about the work that we do. It can impact organizational well-being. So it's, again, thinking about that we're all in this together, and when organizations are traumatized, that sense of we're all in this together gets disrupted. So some examples of contributing events, and I, again, would invite folks to use the chat if any of this is resonating. Response to COVID-19 can be something that did contribute to organizational trauma for many of us and for many of our organizations. Some of us were intimidated by the process of having to think about doing things in these vastly different ways than we did in the past. Others got excited about it, and we thought about, hey, I'm not comfortable, but there's an opportunity to grow and change here, and many of us got excited about that. Part of the uncertainty that was related to COVID-19, of not knowing, of having information that was sometimes contradictory, dealing with change, that we tried something new and maybe we tried it for a few days or a week and it's like, oh, wait, this won't work this way, so we have to try something new. So it's making sure that we stay open to that, flexibility and being able to try new things. But when you're feeling the event as traumatizing within the organization, flexibility is one of the first things to go. In addition to COVID-19, and this overlapped for many of us, there was mass community or targeted violence that many of us were witness to, either in person or, by watching the news and what was on the internet. And so those combined things at the same time really had a deep impact on, elevating the sense of urgency that we have to do something different, but also not knowing for sure what is it can we do, because we may have not been thinking about that or talking about that in our organization, so it was a new conversation. And so, again, as we're looking at this list of things, what you may recognize is that lots of these things were happening all at once. So we had another issue that can be traumatizing for organizations is funding. And so in this field, one of the things I've noticed that can be more frequent than in other kinds of work is that we are constantly dealing with fluctuations in funding. And so we have different sources of funding. We have ways that we work where there's a lot of grant-sourced funding, and what that means is we're doing this particular work for a limited amount of time, and then we have to either find new funding, or staffing is going to change, or our focus is going to change, depending on what our funding dictates. What did we have access to? And we are often in this work in low-resourced environments. So this challenge of, oh, wait, we're dealing with this funding constellation of things as part of our regular day-to-day stuff, and then we have some mass community events and targeted violence that we're thinking about, and we're still experiencing a pandemic. So these were not separate things. All these things happened at the same time. And then what can happen is that in times of change, we may be making decisions that don't seem to quite be in alignment with what we said about our organizational culture and who we are as a group and who we are as a team and who we are as an organization, so that as new things are happening and we're having to make changes in response to those things, there can be conversations that we're having and times when we're noticing that we seem to be doing something right now that isn't quite in alignment with how we want to be and the story that we tell about ourselves. And so, again, when this stuff happens, discussions are often closed, and groups may have a situation where people at a point were used to being a part of problem solving, but now because things are moving so fast, it's more getting informed that a change has happened, that it is participating in how can we change something. And so I wanted to pause a minute and see if folks had any other ideas of contributing events that you wanted to add. Okay. So again, you're welcome to add things as much as you like. We are very excited to talk about a new resource that is available today. So talk about hot off the press. Based on work that the National Center did with a learning collaborative over a year and a half, we talked and worked together. We met as a group. We had projects where we implemented change. We had hard conversations about all kinds of things. And out of that process came the idea for a series of implementation support guides. And so the whole point of these guides is to help at the program level and to support program leaders and coalition leaders in really thinking about how can we be more intentional around implementing services that are more accessible, culturally responsive, and trauma-informed. And so early on in the webinar, I talked a bit about our integrated approach, where we're holding all of these pieces for what does it mean to be trauma-informed in our work. And so in line with that whole constellation of conversations that we've been having and the way that we work as an organization, really wanted to talk about and have space for how do we just name there are challenges that are happening and how can we create resources for programs to support holding all of the pieces that we're holding. So all that said, I'm really pleased to announce that we have a guide, and our first one is focused on the social, emotional, and relational climate within our organizations and organizational trauma, and really thinking about that. So a lot of what we're going to talk about in the rest of our time together is referenced in this guide that is available for you as of today. And I also want to acknowledge Gabriela Zapata-Alma was a co-author on this particular guide, and again, just really appreciative for being able to collaborate with a colleague in this particular work. It's been so much fun. So as we think about, what are the things that help, what are the things that get in the way of us feeling connected and feeling positive about our work, really thinking about what is the impact of organizational trauma on advocates and advocacy. And so again, wanting to name what we're seeing and name what we're experiencing. So grief and loss and high turnover, are things that impact our organizations all the time. And so sometimes we talk about these things and sometimes we don't. The thing we most frequently talk about is high turnover. And there's all kinds of conversations about how to navigate high turnover. And one of the things I would like to share and for us to be thinking about is when we're paying attention to organizational trauma and we're really looking at and thinking about naming the things that we're grieving, the losses that we experience, then we're much more likely to notice what is contributing to high turnover, and we can notice more early on. And so it's addressing this notion that there is a disconnection that happens when all of the things that are impacting our organization can reach this kind of fever pitch. We're at this point where, oh my goodness, we can't take it another minute. We don't have any more empathy. We're not working well together. We often don't pay attention to these things until they've reached a crisis point. And so hoping that some of the things that we shared today can help us think now, before we get to that crisis point, are there things that we can do to support advocates, to support our advocacy, and to sustain our organizations? And I think a key piece is to hold on to the notion that organizational trauma is experienced communally. And it may be that one person surfaces something, but it's what they're naming is impacting all of us. And, there's lots of terms that we use. Again, we notice high turnover when it happens. Some of us are, thinking about compassion fatigue. It's like, in this moment, I've been working with folks. I've had some particular experiences while in the process of doing my work, and I'm just feeling exhausted with the work today. And so compassion fatigue tends to be a temporary feeling. Burnout tends to be more permanent and is reflected in how people talk about their organization and what their organization is or isn't doing. And so whether or not we're talking about organizational trauma, it is impacting everyone. And so again, we've got all these other words that we use to describe what's happening, but it's something that we're all in the organization experiencing, even if it's just one person or two people that are naming it. And so we want to make sure that when staff are saying, this feels really not right to me, or feels frustrating to me, or feels, off to me, that there's a moment where we actually consider what we're hearing and that we talk with each other and try to surface what those conversations can be. Where we tend to focus instead is on, that individual staff person who's been complaining has some performance issues, or that particular person is saying there are problems with their workload, let's say, for an example. And while they might be the person, again, who's voicing this, what's happening may be happening for everybody, but they're the person who's ringing the bell. And so when people are experiencing isolation, they're feeling blame, they're feeling unsuccessful in their work, like they're failing in their supports to survivors, those things can be an indication that something else is happening in our organizations that we need to attend to and name and, take head on, like really, be courageous, as leaders and as colleagues, and just take it on and figure out, this may be hard for us to talk about, but we're recognizing that we really do need to talk about it, or we really do need to change something. And I think if there are any, things, positive learnings from our experience with COVID-19 is that many more people were willing to name or to say, I'm being impacted in these ways, and some of this has to do with me feeling like I can't leave my house and my own levels of frustration, but some of this has to do with how my whole program or my organization or my agency, whatever words you use that you're comfortable with, is responding, and are we in this together? And so when one person is saying, I'm really not feeling good about how I'm connecting with the people I want to serve, we really need to open that up and talk about it and think about it as, just being curious and wondering, what else might be happening here. So what even, further compounds the challenge of trying to, notice organizational trauma versus one individual's struggle is that as people, we're the ones who are experiencing what is happening in our organization. And we're talking about it as, I feel this way. And so it makes it harder to notice, wait, is this something? So we need a reminder, just to, wait, somebody's saying this. Is this something for all of us, or is this something for some of us? And just that exploration opens up opportunities to look at if there are some processes that we have or events that have happened that are creating some challenges. And so even as individuals are talking about, this feels like what's happening to me, it's noticing that there might be something structural that is happening that's creating challenges for many, many others. And so it's how do we make the invisible visible and how do we commit to we're going to explore something together that's been unexplored. And I think that those pieces speak to commitment, to look, and willingness to be aware that something else might be happening. So not stopping at the individual who's expressing that there's a challenge here, but really wondering, is this a deeper challenge for all of us, and how are we going to respond as a collective? Because our whole organization is experiencing something. So looking for the something and doing the exploration for what has been going unnamed. So I want to, again, just pause here for a moment and invite folks to, if there's anything else in the chat, and maybe tomorrow you could share some things if folks have talked about things that have come up in their organizations.
Cathy, I think hi everyone, this is Tamar again. Some of the things that people have observed and shared in the chat box relate to challenges around working remotely, particularly wanting staff to be involved with program decision making, but the challenges presented by staff being dispersed due to COVID and working from home, knowing that program staff have other competing responsibilities like potentially childcare or other caregiving, and that there may be tech access difficulties both for program staff and for folks the program seeks to help, and also that the current political climate is challenging, and that adds an extra layer of stress for many programs as well as the folks that programs are serving.
Thank you so much for sharing that. I mean, thanks to you all for making that, the contribution to this conversation. And Tamar, thank you for, voicing some of that. And yeah, you all are spot on in terms of some of those challenges and what those experiences are. Just as a reference, we did do a webinar on responding to emotional distress, for ourselves, and how do we think about self-care and what does that really look like, during this time of COVID and working remotely. So really appreciating all of that. And so the stressors are real and the experiences are real, and it's hard to feel connected when we're working differently and have different pressures than we're used to having or that we've had in the past. And so one of the challenges for us as advocates is that we are used to being able to explore for actions that we can take and then taking those actions. And so it's harder right now when there are so many things that are impacting our ability to do that. And so in traumatized organizations, staff respond in particular ways. And so, the first thing that comes to mind for me is that there's this lowered sense of effectiveness and feeling like we can do it, and feeling like that, feeling as if our organizations are as competent at supporting survivors as we've always been. And so there's layers of doubt, and then there's the reality that what we're doing is different and doesn't feel as effective and doesn't feel as if we're as connected to people we deeply care about and providing our services. So these are real things that we have to think about and respond to in our organizations. One of the other things that can come up, and this is equally true, is a reduced sense of respect and empathy for the people that we serve and for our colleagues. So we can easily get in this very negative place where there's so much wrong with the world, there's so much wrong with what we're doing, there's so much wrong with how we're doing it, that we start to see the work we do as part of the problem for what's happening. And that doesn't feel good, because then we feel guilty, we feel irresponsible, we feel like even more that we're not measuring up. And then we can also put this lens of negativity on our colleagues. And so that can happen. And another way that this can show up is that we can strongly identify with other staff and service participants and what they're experiencing. And we're unable to separate ourselves from separate for ourselves, like what stressors are mine and what stressors are someone else's. And I am deeply empathetic about that. And what is happening, to my community as a whole. So all of that can get very blurred, and it can be really hard to disconnect from the negativity that's associated with all of that. And so we start to lose sight of, are there any good things that have been happening? Or are there any good things that we're doing? Is there any upside to the work that we're doing right now? So when an organization is traumatized, these feelings of disconnection can show up in all these different ways, but they are deeply felt. And it is really hard to bring the whole organization back to a place of, being empathetic and being, accountable to each other in really good ways, and being able to see where folks are working together, to be able to see that, maybe I'm not the only one who cares about this, but I have others who care about this and who are in this with me. And left unattended, this sense of disconnection can lead to, just this really intense experience where only some of us are in this and some of us are not in this. And, what that does to our organizations.
Cathy, we have just another minute here, so I wanted to raise one more issue from the chat. As you're talking about these feelings of disconnection and isolation, a couple people have mentioned that program leaders have tried to build connection or maintain accountability while folks are working from home, but that actually winds up being experienced by program staff as micromanaging or making decisions without asking staff's opinion. So could you talk a little bit about that, given that it is difficult to have that team cohesion when folks are apart without it suddenly seeming like someone's kind of looking over your shoulder and micromanaging staff?
Thank you so much. I'd love to talk about that. So I'll talk a little bit about that here, and then I want to come back to that when we're talking about things that we can do to strengthen our organizations and be more in touch with our organizational resiliency. One of the things that is unique, I think, to advocacy is that in other kinds of organizations, there's the team is more engaged and maybe in the direct service provision. And what I mean by that is this. So if I work in foster care, which I've done, I'm expecting that I have a whole team of people who are involved with the same family that I'm involved with in that moment. So there's my role. There's someone else who's doing social work kinds of things. There's someone else who's doing more maybe supporting the child's family and supporting the foster family in very specific ways. And so we could have teams of, 5 or 6 people working with one person who's receiving services. In advocacy work, so much more of our work is one-to-one, and that we are so often working very independently in the service of that work. So that when someone is more in touch with what we're doing and they're asking us more about what we're doing and how we're doing it, it can feel like we're being micromanaged. And then on another side of that, there actually, can be some micromanagement, because in this more remote way of working, if we don't have ways that we're regularly connecting, then how does the rest of my team know what I'm doing and what I'm working on? And so I think some of it is around this attitudinal difference in terms of what we expect and the amount of agency and autonomy we expect in our work, and then what's the reality of whose relationships are these. And so what I mean by that last comment is that it's really easy in our work to feel like the relationship we have as advocates with the people that we serve, the survivors we support, it can feel like those relationships belong to us as individuals. The reality is that those relationships are organizational relationships. And so that may be a hard shift for many of us on this call right now. But I would ask folks to just open that door just a little bit to think about. So if I'm an advocate and my supervisor is asking, how's my work with this particular person going, or how am I doing with this particular thing, that particular thing and those relationships are actually part of the responsibility, and accountability of my supervisor and of the program director. So part of it is this maybe a different way that we need to look at how we center ourselves as individuals within organizations. And so there's a response in advocacy that I've seen in other kinds of advocacy organizations. So I do a lot of work in mental health peer support, for example, and everyone who's doing that work is an advocate. And so there are lots of parallels in these experiences that advocates are having. And when someone is used to, being out there, when I'm having a peer support relationship, it's just me and the person I'm talking with. There may not be anyone else in the room or on the phone or in the Zoom chat. So when my supervisor then asks me about that relationship or those conversations, it's not a matter of, well, the relationships are mine and I don't want to share them. It's that these are organizational relationships. So in that instance, it's up to me that I need to shift, that I should be expected and need to be expected to share information about how this is going and what I think is working well and what I think is not working well. I also think that, for some of us in our organizations, supervision looks like different things. So if we've been used to and comfortable with, as doing our work at this high level of independence, and it's only, once a month or maybe not at all that someone is asking me how that's going, then it does feel uncomfortable for me to share that without feeling like a little bit like it's an itchy shirt. Like, why are you asking me about my work? I didn't have this level of attention before. So all micromanaging is not micromanaging is really what I'm trying to say here. And even if it feels that way, it may be a shift in us, or it might be a need for a more transparent conversation for how we're doing what we're doing, how are we doing the work. And I'll come back and talk about that when we have some conversation about what we can do about some of this stuff. And so the other ways that kind of this discomfort and disconnection can show up is that many of us are experiencing emotional dysregulation. So we are, upset. We are overwhelmed. We may be having intrusive thoughts. We may be, angry and frustrated or not feeling motivated to do the work. There are all kinds of ways this shows up. And apathy is the one that, is concerning to me because it's a way that shows up that says, I don't care about what I'm doing right now, or I don't care about what we are doing right now. And so when we're thinking about kind of the impact of organizational trauma, all of the same kinds of trauma responses that individuals can have that's related to their own personal experiences shows up in what kinds of experiences we're having within our organizations. So intrusive thoughts, work-related nightmares, all of those things are real, and then how it shows up in concrete ways is there's, increased absenteeism. I worked with a number of people who were, even though within the response to COVID-19, folks were having a little bit more flexibility and can, use some of their work time to do self-care practices. And, there was some flexibility around, how many hours a day you're sitting at a computer screen in a meeting, right? We were still seeing a rise in use of paid time off and in unpaid leave. So as we're thinking about, again, people are starting to act in particular ways or responding to things in particular ways. Looking at the use of time off is another good measure for what might be happening here in our environment. Some of the characteristics of traumatized organizations and things that show up for us, mission drift is the idea or the behavior that shows up as, oh, wait, we have all of these things that are really on our plate to do, and this is how we work together, and this is how we do it. And I'm going to instead focus over here. It's not really what I'm supposed to do in my job. It's not really what is named within our organization as work I need to do or others need to do, but it feels possible to do it. And so the challenge around mission drift is that it can seem like, oh, wait, people have so many ideas, and you want that brainstorming, and that can be a good thing. But if you step back from it, what you notice is that it's actually showing up, these new things to do are showing up as replacement for things that we're supposed to be doing because of our contracts, because of our work, because of our job descriptions. So it's just being mindful that when folks are finding it easier or more appealing to focus on things that are outside of our scope of work, and there's usefulness in them. It doesn't mean that these are not good ideas. It's just not where our attention is supposed to be at this point in time. And so really wanting to pay attention to that. Our sense of team is disrupted. People can form affinity groups where I'm only going to work with the people who get me or who get what I'm saying or who understand me. And then we get very cynical about everybody else and what they're doing and what their roles are. So, again, thinking about how do we pay attention, how do we notice. There's an increase in distress. There's a lack of safety that we may be experiencing, that feeling inside and outside of work, and we have a sharpened focus on problems but very limited willingness to problem solve. And so, again, thinking about what do we do when our teams are feeling splintered, when anyone who's not suffering or isn't complaining or isn't naming harms is viewed with suspicion. And so lots of judgment gets turned on those folks as well. And so, again, it's just noticing, and all of these things might not be happening, but many of these things might be happening at the same time, and that there's so little effective communication. So a reminder, too, about another webinar we did earlier this year on communication and what can be problematic about how we're communicating when we're under distress. But all good things, good ways that we interact with each other that are positive, stop happening. And people can become evasive with communication, aggressive or rigid. And so, again, we have a whole webinar that speaks to some of those things. One of the other challenges is when, as leaders, we start to notice that boundaries organizations are feeling squeezed and stressed, we may cut off communication with other organizations outside of ourselves. And so in closing those boundaries, we might also be cutting off support from other leaders who are more open about sharing the experiences, because most organizations go through these things at some time. It's just we're not talking about it. And so we lose sight of the big picture. We focus on negativity. There's a sense of despair and loss of hope. So there are things, again, that we need to do when our organizations are feeling in this place. So shifting the focus to healing and resilience can help with that. And, as we talk more in the guide, again, that's available for you all, it's really thinking about what helps is to increase our protective factors. What can we do in advance that really is helpful to the struggles that our organizations are expected to have? How do we routinely cultivate and support self-care? Really thinking about that the reason we engage in self-care is so that we can cultivate self-awareness. It's naming that we need these things rather than acting as if we don't. And then really thinking, too, about after an incident, what do we need to do to debrief and reflect? And making sure that we have activities that are focused on supporting healing. The healing of our organization, the healing of our team, the healing of us together as a group. And so a few things that are helpful. In our organization, at the National Center, we went through a process where we revisited our mission and our vision and our values. And that process, I appreciated it so much, I can't even tell you how much, that it, in my opinion, brought us together in a really positive and collective conversation where we re-looked at our mission and we created a vision statement. And it brought us to a place of connection as a unit, as an organization that was, it felt powerful. It felt like we were naming the things we want to do together. And so having all of that clearly stated and the process of reviewing it, I feel like it set us up for, our next set of challenges. And we're more, cohesive and moving forward in a way that's saying, yes, we're in this. And making sure that all of the things that we do and have said in our mission and vision and value statements, we're actually, when we look at our leadership, our leader is modeling those same values. And that we see our values reflected in the way we do services and make decisions, that we're clear about the alignment between the way that we work and what we said is important to us. So the process of looking at our mission and vision and values actually made some positive contributions to our organizational climate. And I think that that will ripple out for a long time to come. When we're thinking about other things that we can do in terms of strategies for prevention of organizational trauma, that our leaders are intentionally focused on we are in this together and conveying that message over and over and over again. So it's important not just that we name what our mission, vision, and values are, that we're modeling that, and then in our interactions with one another, we're actually having time where we connect. And so what's interesting about, just to go back to that conversation about, more virtual meetings and more wanting to establish more connection and people feeling that that's intrusive. Again, the other side of that is, do we have a time that we're connecting? So early on in our response to COVID as a national center, we established a time where we could just connect with each other and say, how are you doing? And is there anything that you need support with? And so we don't need to always have that in our organizations, but it was really, really helpful in the beginning. And I know that that was true for a lot of organizations that I've talked with. So having that check-in time with, are you okay? I'm okay. This is what's coming up for me, or I'm not okay because this is coming up for me. And I'm trying to maintain these connections with the people that we serve, and I'm struggling with doing that. So having a space for that was really important. And having a space where we can also talk about what's coming up in the work. So that let's connect conversation was separate from let's have a staff meeting about everything that's on our plates. Was separate from we need to have space where we can still give each other feedback and incorporate that feedback and see it as opportunities for growth and learning. When our organization is making changes, having staff involved to offer their ideas, to actually hear all at the same time, this is what we want to do, these are the changes we need to make, this is why we need to make them. Can we talk about this? So there's a specific role for leaders in expressing those vulnerabilities and modeling those vulnerabilities so that staff can also feel that it's okay to be vulnerable. It's okay to be not knowing. Because we work in advocacy, the stakes are really high for the people that we serve and for us to show up with our full selves. So we need to make sure that we can do that. So the ways that we offer emotional safety to the folks that we serve, we need to do that with one another. And so as leaders, are we being consistent? Are we being open? Are we being flexible? Are we behaving in trustworthy ways? Are we focusing on staff development? And so that includes, for staff, a focus on we are a learning, growing organization, and we all have room to learn and grow. And so if we don't have ways that we can give each other feedback and can hear that, we're missing opportunities. And then when we do get feedback, it's going to feel personal rather than, and that we've done something bad or that we are bad people, rather than here's an opportunity for growth and learning. So there's some stuff here that relates to supervision, and there's some stuff here that relates to what are our policies for time off. Do we have good wages? Do we have, sustaining wages? Do we have health care? Do we have an employee assistance program? So if we are modeling vulnerability as leaders, and we're also talking about using our resources and demonstrating to staff that they matter, then we are strengthening our organizations. If we focus on the realities of our work, we're actually naming that these things are coming up in our work, that they are important in our work, that we can be open and honest and direct about the challenges that we're facing, then we have an opportunity to support staff's growth and development in a way that feels respectful to them as well. I want to talk for a few minutes about critical incident debriefing and opportunities for reflection. So we talk more about this in the guide for sure, but when incidents come up, we need to be able as a team to actually unpack what's happening. We need to say, this hard thing happened, this terrible thing happened. We are grieving this thing. We have this loss. We need to name what just happened so that we can make it real for folks. When we don't attend to the horrible things that may be coming up in the course of our work, it sets a tone or an expectation that this shouldn't bother us. And the more you hold that stuff in, the more stressed we become. And most of us are really familiar with what the outcomes of that kind of stress can be. So when something happens, the closer we can meet together and talk about it, talk about the what happened, talk about our feelings related to what happened, and that we can do this processing and debriefing with a supervisor, or we can do it with our colleagues, our peers. We need to show up for each other and spend time thinking about and talking about the things that come up for us that are related to grief and loss and traumatic stress on our organizations. So the process that helps is talking about what happened in very, very clear, very open, very transparent ways, really naming the hurts that have come up, naming how we're navigating and managing, naming that this was really hard. So the next piece we need to talk about, what are our thoughts and feelings about it, right? So what was hard about it? And some of us like to talk about our feelings. Some of us wake up in the morning and we're all about sharing feelings. Other of us are not, but maybe more comfortable talking about, well, my thought about what happened is, or my reaction to what happened. But whatever that is, whether you express it as thoughts, whether you express it as feelings, we need to be able to talk about it in a way that says, yes, this happened, and we need to attend to it. It's important that we attend to it. The next piece of this is really doing some perspective checking and getting feedback. And this is where, as supervisors, we spend time really thinking about and talking about and engaging in. Let me share with you my thoughts about this. So I might listen as a supervisor, I might listen as a colleague who's supporting another colleague. And then I'm going to actually say, this is what I think about this. Or I wonder if there were some undiscovered or unexplored options. I wonder how other folks may be handling this. And then I may just give some feedback or options to do some further explanation. But important that we make a plan for how we're going to keep talking together about what we can do either next time this comes up, or if I'm feeling bad about this tomorrow, or if I'm still feeling disconnected, what's our plan to go forward? And we don't go forward until we have a plan and we've talked about, the what happened in a really thorough way. And we've also talked about, are there some additional resources we need to bring in? And it's possible that we might need some additional training. Mostly what we want to be thinking about together is what are the things that we can do to support healing. And again, that takes acknowledging the grief or acknowledging the sorrow, acknowledging the loss or the pain, whatever that experience was, acknowledging the frustration, and then being able to have continued discussion about what will help keep us moving forward and not get stuck in this place of unresolved grief. And so being able to tap into each other and each other's energy and each other's thoughts and discussion around what will help us heal, what will help us move forward, and then acting on some of those things, acting on what feels possible. I get concerned when folks say there's nothing we need to do, or folks will say, well, this is just our work. This is part of our work. This isn't something we have to heal from. So remember, going back almost to the beginning of this conversation, that trauma is pervasive in our work. So having traumatized organizations in our work is really, really common. And then because approaches to grieving may be private or culturally unique, we want to make sure that what we're talking about feels possible for what can we do together. And there may be things that people want to continue to do on their own. But part of healing a traumatized organization is that we have some group work to do together about how we're going to function, how we're going to reconnect, and how we're going to do some relational repair if that's what we need to do. And we can't assume that there isn't repair to do, and we do need to remember that healing takes time. So as we're reflecting on our experiences, really taking a moment to think about, are there losses we are grieving? I mean, this would be a great conversation for a staff meeting. Are there things that have happened in our organization that we're holding, whether it's holding in grief or holding in resentment or holding in fear? We need to make sure that there's an opportunity to surface those things so we can talk about those things and start to heal our organizations. Are there things that we can do together to focus on overall health and wellness within our organization? What can we do there? What can we do about that? And so really thinking about, what as a collective we can do to support our own health and wellness and also contribute to it. Are there things that as a leader I would like to change about our organizational climate? And so that can be a challenging one for a leader to look at in a clear way. And so getting comfortable as a leader with my own thoughts about there are some things that could feel better for working here and the work we do collectively. And it doesn't mean I'm a bad leader if I notice. It means that my leadership is being more open and I'm sharing more of it when I'm looking to name, are there things we could do differently? And then is the planning for what we're going to do about those things that need to feel better. And that can start with, do I have the resources and support that I need to make the changes I would like to make? And so really thinking again then about, as a leader of an organization or leader of a team, where are my resources for support and how do I access them and what are the things I can do? I wanted to share this from a leader this was from a program director who was a member of our learning collaborative, and this sat with me in such a powerful way. Hearing about the dynamics and employee relationships that were present at other domestic violence and sexual assault programs, really helped us begin to see the impact of trauma on our staff. As leaders, we were able to stop blaming staff for those experiences and avoid getting stuck in personalizing their behaviors. And this was a conversation that was so powerful because it really meant for this leader changing things and approaching things in a very different way. And I'd like to say it was fearless, but it wasn't without fear. It wasn't without worry of being vulnerable, but it was something that the leader was really willing to do. So, again, I want to thank you all for your contributions, and we have a few minutes if there are any questions or comments. While, Tamar, you're looking to see if there are questions, I did want to share one resource. We've shared it in the past on other webinars, but, it's so important for this conversation as well. There's a resource called Virtual Room of Refuge, and it's just been incredibly helpful for folks who are considering different ways to both think about their own self-care and self-awareness, but also sharing ideas that can come back that they're sharing with their teams and sharing with groups, and it's really been helpful. And the one other resource is there's an author, Millie Greneau, who has done a lot of work around looking at organizations and coming up with some very brief 1-minute activities that people can do to support and sustain their own wellness while at work. And so, Tamar, was there any questions coming up? We've got a few minutes.
Thank you, Cathy. Right now, we don't have any questions coming up. For folks who are still contemplating, we do have a few more minutes for questions, so feel free to share them in the chat or in the Q&A box. And I just want to let everybody know that I did put a link to the Virtual Room of Refuge in the chat, so you should all be able to see that.
Oh, thank you so much for doing that. Appreciate it. So again, just really thinking about organizational trauma as something that needs to be named, and then we can begin the work of what do we do in our organizations. We can think as leaders about, do I need outside support, and what are the things I can do? I'd like to invite all of you to access the implementation guide. It's a piece of work that those of us that worked on it are incredibly proud of and happy to share today. And I think with that, Tamara, I'll turn it to you for the closing.
Thank you. And we are getting a couple questions about viewing this presentation afterwards. So just to confirm for everyone, we will share a full recording as well as the slides and, of course, our new implementation guide with you. You will receive that within the next week at the email address you used to sign up. So do not worry, we will share that. And as we are about to run out of time, I just want to thank Cathy for today's webinar. Thank you to all of you for spending your time with the center. As I just mentioned, we will follow up with an email link to a recording of today's webinar in addition to the slides and handouts referenced, all of which will be available on our website. You will also receive a certificate of attendance for your time today. That will come in the same follow-up email. At the end of this webinar, you will be taken to a very brief evaluation. If you could please take a moment to let us know what was useful and what could have gone better, that would be greatly appreciated. Thank you again, and we hope that you have a wonderful day.